In this video, I'm going to review the review course SNO-Flake Mnemonic and how it can help you manage any SOO or SAMP or OSCE scenario in less than 3 minutes. Hi, I'm Dr. Simon Moore from the review course in family medicine. Right now it's April 2025. It is the day before the spring Canadian family medicine exam. And I see tons of questions coming into our Facebook group, the reviewcourse.com Facebook group. And I've been trying to answer as many of those as I can because I know the stakes are high, stress levels are high. And I saw your question come in, Dr. Ranji, about the SNO-Flake Mnemonic. So why don't we break down this mnemonic so that you know exactly what it is we're referring to. This mnemonic was taught during the shortness of breath lecture. So if you want to see this taught in great detail and you've registered for our online virtual course, you can go to the shortness of breath lecture and you can see me break it down there with the help of my colleague, Dr. Paul Dillon. Now, this mnemonic came to my mind when I was a OSCE examiner, and about 8 minutes into the OSCE station, buzzer sounds, and my job was to read from the questions sheet and say, what is your management of this patient with heart failure? And every single candidate in that room said Lasix. And I'm thinking as the examiner, okay, that's fine. But there's like 17 other things on this list. And the worst part was they knew them. These were not complicated management steps. This was straightforward things that I knew if I could just nudge them and give them a bit of a detail information, like a hint, they would be able to ace this management step. And so that's where the SNO-Flake Mnemonic was born. It's called a SNO-Flake Mnemonic because it goes SNO, safety, next visit, offer, and then you just go through the alphabet, PQ-RST. So let's break it down step by step. And S is for safety first. On any OSCE or on any SOO, this is a situation in which you've got to stop and think the medication they're taking, the means in their home, the gun, the knives, the sedating drugs, the fact that there's children in the house, the fact that they are a long haul truck driver. Could there be a safety risk involved in this situation that I need to be aware of and that I need to manage and that I need to mitigate, especially if there's something going on like suicidality? Your management's going to include something like referring to emergency department, or if that's where you are, committing the patient or something along those lines. N stands for next visit. There's always an option for follow-up, having them back, coming back at the next visit. And think about that. And that's what the N is there for, is to remind you about the next visit. Not only that, though, what are we going to do at the next visit? For the Canadian Family Med exam, we're always going to be doing a physical exam. Come back to the next visit. Let's do a physical exam. Not only that, who are they going to bring to the next visit is going to be their loved one, their partner, their friend, their confidant, whoever they mention is important to them. You say, feel free to come back. Let's see you back here in a week or two. We can do a physical exam. We can get your old records, and we can have the person that you mentioned that's really important, you can join as well if that's what you like. O is the next letter in the mnemonic, and it stands for offer. And you're going to offer to do all those things. You're going to offer to be their family doctor. You're going to offer to do investigations. You're going to offer to get their old records and ask their permission to do all those things. P stands for prevention. Patients with heart failure. How do we prevent exacerbations? Vaccination, exercise, daily weights, sodium restriction, all these things that you know, with just a bit of a nudge, we can remind you. How can we prevent infectious diseases, vaccinations? How can we prevent exacerbations? All of the above as well. Q stands for quit. What do we need to quit? Let's quit all those things that are contributing to this disease, quit the sedentary lifestyle, quit the negative lifestyle factors, and quit those things like smoking that can lead to worsening of the condition. R is for refer. My patient with heart failure. Can you think of 10 different places where we would refer that patient? There's so many options, especially if you're in an OSCE, you're in a SOO station, and you're trying to think, where can I refer this patient to? Well, cardiology, of course. But they mentioned the stress in their life. Think about counseling. Can you be specific? Can you think of a specific kind of counseling, whether it be marital counseling, financial counseling, stress counseling, relationship counseling, if it's something along those lines, cognitive behavioral therapy counseling, send them to a psychologist. Is there something else we can refer them for? Pharmacotherapy? Maybe they're on a long list of medications. They don't know how to take these. Refer them to a pharmacist. Are their symptoms so severe? Are they New York Heart Association Class 4? Refer them for palliative care. There's so many options for referral, and not just the basics. You can think of the more advanced things. If you work rurally, a lot of our residents work rurally and they don't think about, electrophysiology, heart function clinic, the heart failure clinic. Lots of places, lots of options to refer these patients. S is for start. We start medication, start Lasix, obviously, for managing this patient. And if they do have heart failure, obviously the newest guidelines say we've got 4 new medications we're going to be giving most of our patients for heart failure with reduced ejection fraction. And T, finally, teach. We've got to counsel our patients, tell them we've got a nurse educator who can help with these things. Tell them we've got a brochure we can offer you that can help with these things. There's always a way we can teach our patients and advise them about their condition and say, if you want some more information, we can help you out with that. So that is the SNO-Flake Mnemonic, SNO-PQ-RST, and it stands for safety, next visit, offer, prevent, quit, refer, start, and teach. It's all summarized in your print manual if you came to the review course in person this year. If not, take a screenshot. Here it is. Hope you ace your exam. Wishing you all the best. I know it's a really stressful time. That's why we're here to help. I'm Dr. Simon Moore from the review course in family medicine with the SNO-Flake Mnemonic.